Hello, my name is Jacob Segars, and I'm going to be doing renal failure today for my project. Okay, so here's my slideshow. Okay, so with renal failure, renal failure is loss of the main functions of the kidneys. In other words, they're not working no more. Not being able to produce urine can cause the ability, not being able to get rid of fluid, also waste, and maintaining a proper chemical balance in the bloodstream, such as potassium or sodium. This could be an acute renal failure or chronic renal failure, which affects people with type 1 or type 2 diabetes and also hypertension. It affects mostly people at middle age, but nowadays, especially in the U.S., how bad our diets can be sometimes is also with younger people and also children as well and young adults. As of right now, the chronic renal failure causes up to 50,000 deaths per year in the United States, which is absolutely crazy. Then we have signs and symptoms. So your signs can happen there's so many signs for this, but up to like yellowish skin, not being able to urinate enough or a little too often, headaches, loss of appetite, muscle cramps. You can have pain in your lower back or abdomen, edema, tired, and weakness. And then also, like when you're being diagnosed for whatever if you have this renal disease, the doctor will run some blood tests, some urine tests, maybe the results of kidney function. They can also use x-rays or ultrasound checkings for these. And as you can see in the photo right here, you can see the x-ray right here. You can see the kidneys on both sides. It kind of looks like a face. It's pretty crazy. Let's see here. And then on the physiology part of it, when there's kidney damage, it can cause the glomerular filtration rate to drop fast, which is not good. So the nephrons begin scoliosis, sorry if I can't pronounce that, which causes the glomerular filtration rate to stay down completely. Dangerous levels of waste will rise across your blood, and you'll lose balance because, there's no longer any filtration, which will cause a lot of damage and shut the kidneys down. So there's different kinds of treatments that you can do for this. You have either hemodialysis or you have, if I'm saying it right, peritoneal dialysis. So the treatments that you can do is hemodialysis. It's where the patient is hooked up to a dialysis machine. Sorry, I have my dogs in here. That monitor and maintain blood flow. And dialysis, which is a chemical that is used to draw waste products out of the blood. This process can take up to 4 hours, and it must be done 3 to 5 times a week, usually what they were saying at the same time. So, that's very, very time consuming. And then also, which one is a little bit easier, is the peritoneal dialysis, because anyone can do this at home. Once they show them how to do it, which is also removes the waste and excess fluid by using Parison's abdominal lining to a filter, which mimics the kidneys. This is also easier versus where you can do this on the go versus have to go to making a doctor's visit and everything. So if I can, as you can see right there, that's a hemodialysis machine. As you can see where the blood, whoops, let me go back, I'm sorry. Let's see here. As you can see right there where the blood flows to the dialyzer and it comes back, the blood gets filtered through and cleans and comes back into the body through the veins. And like I said, that can take up to 4 hours. So that can take a lot of your day. So out of the two, the peritoneal dialysis is the best way to go. Now also you can do, which is a kidney transplant, which is usually towards the final stages of your disease when it's getting really, really bad and there's no more options, nothing's helping. So the kidney transplant, obviously takes control when the old kidneys are no longer in effect. The kidneys are inserted into the abdominal cavity posterior to the original paired kidney. The ureter on the new kidneys attached to the bladder. As you can see right here, if I can zoom in on this picture right here, you can see the ureter where it connects to the bladder right there. And then also, taking the kidney artery and veins and connecting them to the iliac artery and vein, which you can see right here, where they can fuse it up. And also, one thing about the kidney transplant, it's always best if it's a family member or someone with like the same blood type as you, so you won't have any type of like rejection from the kidney, because that wouldn't be good, and then you won't be able to survive. Whether the outcomes are fatal or not, renal failure can be fatal if it's not treated by a doctor, where the kidney transplant rejects. It affects you on a day-to-day basis, and it can be very painful from the symptoms, very time-consuming with the appointments, and however how long the dialysis can take. Like I said, whatever route you go, it can be up to 4 hours, or to 3 times to 5 times a week, which is a lot of time. And also the emotional side of things, it always keeps you worried. It keeps your stress level up, which is not good for you. So so if you have any type of symptoms, don't be afraid to go get checked out, because you can get rid of the problem, at least prolong the renal failure until if you have to, worst case scenario, you have to get a transplant. So current research, which is kind of cool, recently at Marshall University has discovered that some fat cells can help with renal failure. They discovered that the production of peptide, nectide, and fat cells can inhibit the sodium pump. It also inhibits the renal failure connection to cardiomyopathy, if I'm saying that, and anemia. This research shows that the sodium, potassium, ATP, certainly can amplify oxidative stress, lowering the progress of renal failure. Let's see here. Sorry, my computer's kind of sensitive. Excuse me. Okay. So patient history. Now, this is a big deal to me. See, my patient history would be myself, which is about 2 years ago. I was 27 at the time. I was at school, walking to class, and I couldn't even move. The pain, I had a sharp pain that went through my pelvic region, all the way up to my anus, and it literally felt like someone was shoving a knife up there. I wasn't even able to move. I was able to get home, and the pain started again. I was rushed to the emergency room, and they ran tests on my blood, and they also checked my prostate. They even did an ultrasound on my scrotum, trying to figure out what was wrong. Everything came back negative, but I did have high blood pressure, and they eventually sent me to a urologist, and they ran more blood types and urine tests on me. And then turns out I needed, like I said, I needed a healthier lifestyle. I was drinking too much alcohol. My fast food intake was insane. I was eating fast food, 7 days a week, 3 times a day. And then, the pain was so unbearable. Also, when I was trying to go to the bathroom, not everything would come out sometimes. So that was very painful, and it was very stressful on me. And then, so when they put me on this plant-based diet, and, they made sure I was drinking a lot of water and making sure that the lifestyle for my kidneys, because I was just having way too much fun, or too much pleasure in things I was doing. And I was able to get rid of that by switching my diet. Like I said, all I eat now is a plant-based diet. I drink a lot of water. I stay away from alcohol. Every now and I have one every now and then, but it's really been able to reverse it. And every time if I even fall off the wagon a little bit, usually the pain will come back. Not as bad, and it doesn't happen as often. But it was giving me a lot of issues. We're going to the bathroom, even having a erectile disorder sometimes. It was it put a lot of stress, a lot of emotional stress. I was always worried about what was going on. I always had to plan my day on, when I was going to class, make sure that I was able to go to the restroom and get everything out, but I always had to make sure my kidneys were always hydrated, so I always make sure I drink plenty of water. But as of right now, I've been doing good. I haven't had no issues, so I can't complain. But once again, my name is Jacob Segars. I gave a presentation today over renal failure, and I hope you guys enjoyed it, and have a good day. Okay, thank you. Bye-bye.